Hearing loss is a common problem. It affects almost 10% of adult people and every third person after 65. Important enough that they need hearing aids. We will discuss the top 8 causes of hearing loss. The most important sign of hearing loss is when you struggle to follow conversations in busy places.
Tinnitus, noise in the ears, even many years before hearing loss occurs, can be an early sign of a hearing problem because it indicates the damage of cells which are responsible for hearing, when it is difficult to identify the direction of sound. When there is increased sensitivity to loud sounds, also indicates auditory pathway problems. Let's discuss how we hear. In the environment, there are mechanical waves in the air which are molecular because of vibrating air molecules, which we call sound waves. The sound wave hits the eardrum in our ear and causes this membrane to vibrate.
We have 3 tiny bones behind this eardrum, which we call the middle ear area. And these bones start vibrating also and amplify the sound and transmit it deeper into the ear. We call this the inner ear. The last bone transmits vibration in the fluid inside the cochlea. These fluid vibrations cause movement of hair cells, which are specialized cells for hearing. And this mechanical vibration is transmitted as an electrical signal in the cells and travels towards the brain, and we perceive it as environmental sound. The most common cause of hearing loss is age-related, which is called Presbycusis. It affects 33% of people after 65. Such hearing loss usually is partial. Not complete hearing loss. It happens gradually and affects both ears. It affects high-frequency sounds first. The main risk factors for age-related hearing loss are noise exposure over a lifetime, genetic predisposition, and aging. Generally, there is a correlation between hearing loss and dementia. People who have hearing loss are at a higher risk of cognitive problems also. There is strong evidence that people with mild hearing loss have a doubled risk of dementia, and severe hearing loss increases dementia risk 5 times. The main mechanism of age-related hearing loss is the degeneration of hair cells over time in the cochlea, especially the cells which are high-frequency sound sensitive. It happens because the cells, which are responsible for high-pitched noise, are more delicate and sensitive and damage easier. Also, they are nearer to the strongest vibration. Noise and toxic substances over time damage the cells. Also, vascular problems. Reduced blood flow to the cochlea impairs its function. First signs of hearing loss usually occur after 40 but may go unnoticed initially. It progresses over time slowly. The second most common cause of hearing loss is noise-induced hearing loss. It affects around 17%. It happens when a person is exposed to loud noise for prolonged periods. It can be both gradual or sudden. For example, after an explosion, common in industrial workers, musicians, military personnel, and people who listen to music loudly. If you stay more than 8 hours in noise, 85 decibels and more, it causes hearing loss over time. To put it in perspective, it is the noise level in a busy traffic street. Nightclub noise causes ear damage even after 15 minutes. A gunshot at very close distance can cause permanent hearing loss. The third most common cause is ear infections. Middle ear infection called otitis media or outer ear infection called otitis externa. It is common among children, but less common in adults. Usually causes temporary hearing loss, is possible, but rare.
Usually affects young children, causes pain and fluid buildup in the middle ear. Poor hygiene, swimming contaminated water, and recurrent ear infections are the main risk factors. The fourth most common cause is sensorineural hearing. It is responsible for 90% of all permanent hearing loss cases. It happens when inner ear structures or the auditory nerve is damaged. Usually gradual, but may happen at once. For example, acoustic trauma. Such sensorineural hearing loss is common after 70. It affects almost 60% of people after 70. Common causes of such damage are prolonged exposure to high noise and medications, antibiotics, aminoglycosides, and chemotherapy drugs. Also, loop diuretics and some genetic disorders, in rare cases, autoimmune ear disease and infections like meningitis or mumps, explosions, gunfire and industrial accidents, nightclubs, they can cause acoustic trauma and cause permanent hearing loss. The fifth common cause is congenital hearing loss. Around 2 in 1,000 newborns are with hearing loss. Main risk factors are usually genetics or maternal infections during pregnancy, for example, rubella.
The sixth most common cause is Meniere's disease. It affects around 0.2% of the population. Hearing loss is commonly associated with noise in the ear, tinnitus, and usually starts in one ear, unilateral, and worsens gradually. Important hallmarks of Meniere's disease are episodes of vertigo, which last more than 20 minutes, hearing loss, which affects low frequency initially, tinnitus, which is often described as a roaring or buzzing sound and a sensation of pressure or fullness in the affected ear. The seventh common cause is impacted earwax. It affects around 15% of adults and up to 35% of the elderly. Hearing loss is usually temporary and common in people who are using hearing aids. The main risk factor is poor ear hygiene, overuse of cotton swabs, and a narrow ear canal. And the eighth common cause is traumatic injury, usually associated with head injury or barotrauma. For example, that can cause complete or partial hearing loss, dependent on the underlying cause. Now, let's discuss how to protect our hearing. Avoid prolonged noise more than 85 decibels, which causes irreversible damage. Use earplugs or noise-cancelling earmuffs in high noise settings. 85 decibels up to 8 hours is considered a safe threshold. And using earphones, use the 60-60 rule. Keep the volume less than 60 and no more than 60 minutes. Use noise-cancelling earphones in loud settings. Avoid smoke. A balanced diet and exercise regularly decrease hearing problem risks. And treat ear infections in children promptly, not to increase the risk of permanent